Hello, my Red Tribe, and welcome to another episode of Dr. Red Diaries. So in this episode today, we'll continue talking about the hidden cost of falling sick in Nigeria. The first thing we'll talk about today is money. And that's the most obvious one. When people go to the hospital, for example, one of the first things they talk about is not, okay, why am I sick? Or what's the cost of the illness? The first question they will ask, even me as a doctor, would be, how much will it cost? To read this, how much will it cost? To go and do this, how much will it cost? To buy this medication, how much will it cost? Even when I prescribe medications for people, the first question they ask me, sorry, doctor, how much will this medication cost? And most times I'm always like, go to the pharmacy first. I may not know the price, I may know it, but most time I don't want to discourage them because you'll find out that most people will not end up buying that medication. So financial cost is one major cost or hidden cost of falling sick in Nigeria. I have had to pay for medical bills. I have met mothers, fathers who had to sell their properties, things that they own, just to pay for not even comprehensive bills like maybe surgeries and all. I mean basic medical bills. That I had the opportunity to work in a health care center in Lagos here. There were so many cases I dealt with in the community where people were not even able to afford RODT test, malaria test. Then it was like maybe 500 naira. They could not afford it. They could not afford to pay 500 naira for the cost of that test. And now let's even break down some of the things you would pay for in the hospital for when you visit the hospital to see the medical doctor to treat any form of medical condition. The first thing, registration. Let's say you're going to do it for the first time. You register, pay for registration. You pay for consultation. There's now the general consultation. There's consultation for specialists, again, depending on the medical condition. After consultation, you pay for tests. I grew up learning medicine where we request for investigations after we've ruled out certain cause or indication for their complaint. But we see now that a lot of hospitals just prescribe or request for a dozen amount of tests. Some of them are irrelevant, some of them are not needed at that particular time. So now, cost of investigation. The next cost most people consider, medications. Medications now are very expensive. So you consider that before you even think of the medical condition that the person is even dealing with. Cost of medications, transportation to that particular hospital. So when you put all this costs together, you will now ask yourself as a patient, for example, where will I even get the money to now pay for other things? You may not even, the money that you bring to the hospital may not even be enough to cover these things that I've listed. So the next segment to consider now is delayed care and complications. It's also another common eating cost in Nigeria when someone falls sick. There was a story I heard recently, I think last week, this year 2026, of a lady who went to the hospital. They diagnosed her with appendicitis, they went to do appendectomy. This is a big hospital. I don't need to mention the name of the hospital. A very big hospital. They diagnosed her with appendicitis, went to do appendectomy for her, took her to the theater. She spent a lot of money. Her family members spent a lot of money, almost in the millions, to do the appendectomy, to remove the appendix. They took her post-op into the ward for her to recover. First day, second day, third day, she wasn't getting better. She started running fever. She was having symptoms of severe infection. The site of the injury of the surgery wasn't healing. So many things were happening. They took her back to the theater. They found out that the doctor left. This thing I'm saying is a very common thing that we hear, but this thing happened recently. And in a very big hospital, the doctor actually left one of the bandages and the sponges he was using to do the cleaning during the surgery, they had to do another surgery again. Guess what? They requested for money from the family members. They have to go and bring someone to do another surgery. To cut the long story short, this lady died. Why? Because of complication from the hospitals. From the hospital that she went to. That's another hidden cost of falling sick in Nigeria. Another hidden cost is delay in the hospital. You go to the hospital, we have the ratio of one doctor now to 20,000 patients. You sit down for hours, and triaging in the hospital is terrible. Triaging is when when you come to the hospital, we decide if your case is an emergency or a top priority as opposed to the other person. That's triaging. Triaging is important in the hospital, so at least we're able to deal with the emergency or urgent cases while we figure out how to manage the not so urgent or emergency cases. But aside from that, we have situations where people wait for hours. You have the money. Now you have the money. People now wait for hours to receive basic care. You wait for 1 hour, 2 hours, 3 hours. You're paying. This is not even your trans problem. You're paying, but you have to wait for a very, very long time to receive basic care. And it's terrible because one of the major challenges of delayed healthcare or delayed treatment in Nigeria is the fact that we judge most times based off of physical symptoms. What we can see. So if the person does not look sick, we say, I know this case is not urgent, which is a terrible way to actually diagnose and determine when to treat a person. So delayed treatment, delayed time in the hospital, spending long hours in the hospital is another hidden cost of falling sick in Nigeria, and it needs to be addressed. So the last segment is the cost of healthcare system. So this is also an important aspect because we're dealing with a lot of jackpot syndrome in Nigeria, especially in the healthcare industry, where a lot of doctors, nurses, healthcare workers in general are leaving Nigeria to other countries to continue their work and their career. And that's the current challenge we are facing in Nigeria. We are having the resident doctors, for example, going on strike every other day. Why? Because they are not paid properly. They are suffering from burnt out. They are suffering from brain drain. They're having to deal with both physical, mental issues and challenges, and they still have to show up to work every single day. They are running back-to-back shifts. They are working long hours of the day and don't even have time to rest. These are also humans, and most times when these things I've mentioned take a toll on them, it will reflect on their work, whether we like it or not. It will reflect how this output will be the type of service or consultation or treatment that you would get to receive. So that's why it's important for us to also consider that when we visit the hospital, when we go to receive treatment. And the reason why in Nigeria is an important topic to talk about: brain drain, burnout, and the cost of healthcare system, how expensive it is to be a doctor, to be a nurse. And when I mean expense, I'm not even referring to financial cost. I'm referring to mental, emotional, and even physical cost of being a medical doctor, a health practitioner in Nigeria. It is a major challenge that we are currently dealing with. Okay, now let's talk about what can actually help. I like to provide solutions. That's the idea of this platform, to provide solutions to most of these issues. What can help? One, for the financial costs. Let's stop treating healthcare like luxury. Healthcare in Nigeria currently is a luxury, but it is not supposed to be luxury. Healthcare standard, it is not luxury. It is something that should be easily accessible by people. Number one, hospitals, the regulators, let's stop treating healthcare as a luxury. And I think one of the ways we can really help is these hospitals. Hospitals, we need to do better. I'm referring to the hospital management now. We need to do better on how we price our medications on how we price investigations. I've gone to the hospital where I know the cost of this investigation, even this medication in the pharmacy. I will go to the hospital for that same medication. It is 8 times the price. Sometimes 10 times the price. It is ridiculous. I understand that you want to make profit, but you can't make profit at the expense of the lives of people. Especially when you know the country that you are in, you know what we are dealing with here in Nigeria. Please and please and please. 2 times the price is understandable. You will still make your profits. And I'm being very direct right now. 2 times the price, you will still make your profit. Let's be considerate. Let's understand that these people that visit your hospital are Nigerians, are people that you see every single day, are friends, colleagues, family members that you have. We need to bring down the prices of our medications, our investigations, and the cost of consultation. We need to bring them down. Number 2, our emergency system in Nigeria, in the hospital, needs to be reviewed. We're supposed to have a functional emergency triaging hospital. That's one. Our ambulance, we're supposed to have an emergency ambulances as a government in Nigeria for each state. We are supposed to have that. Those things I'm mentioning are basic care. When we have that, it's easy to be able to transport people within the state, within the country, for them to easily access care. And then for patients, it is important right now to be able to start considering health insurance. Health insurance is one topic I'm very passionate about, and I'm going to talk about it in another episode. Health insurance now in Nigeria, a lot of people don't understand the benefits. They don't understand the benefits. They're not aware of what health insurance can cover and should cover. And you don't understand how important health insurance will really alleviate and reduce this stress and financial burden that you're having to deal with. And there are several types of health insurance that you can access in Nigeria. There's community-based insurance that can be set up in your community. It can happen. There's government health insurance. There is private health insurance. So these are several ways that you can actually access, several things that you can actually do and access to be able to reduce and alleviate these hidden costs. So for the next segment, I spoke about the delayed care and the complications. The truth is, healthcare workers, we need to do better. I'm a healthcare worker, so I really have to call us out. We need to do better. I've always believed that if you're going to, and I said it in one of my episodes, if you're going to become a doctor, a nurse, a healthcare practitioner, you have to be passionate. You have to be passionate. Even if you're working in Nigeria or outside Nigeria, you have to be passionate about what you are doing. You're being called to serve people, and you have to be willing to serve and do the right thing. The idea of forgetting bandages, forgetting sponges, and so on and so forth in the body of a human being, the person having to die at the end, should not be heard of in 2026. It should not be heard of. The fact where you just keep people in the hospital and delay them unnecessarily. I have experienced this even as a doctor, being a patient. It should not be heard of. There are several ways we can triage in the hospital. There are several ways we can even fast track the processes and the steps. Reduce it, fast track the process and the steps when people get to the hospital. From when they register to when they see the doctor, if they want to run tests, they want to get medication. These steps can be shortened. When people go to the hospital and sit down for hours, they are seeing the nurses or the front desk worker, they are laughing. Nobody's attending to them. That should stop in 2026. If you see, I've not even mentioned the government, because the truth is we are the government. When we start working on ourselves and how we address these issues, trust me, we will see the change in general. It is very, very important. We need to be passionate. We need to treat people well when they come to the hospital. Address them accordingly. Guide them the way they are supposed to go. Hospital should be a safe place. It should be a safe for people to come to receive treatment, to receive help, not to come to the hospital and go back with more problems. No. We need to do better in 2026, and these are the things that would really help. If you're not passionate about your work, You're not passionate about becoming a medical doctor, please leave the medical line alone and go and do something else. It is very, very, very important. Lives of Nigerians are at stake every single day because of what is happening in the healthcare system, and we cannot continue like that. So the last solution for the last segment I mentioned regarding the cost of healthcare system in Nigeria, this is now for the government and for those who are owners of private hospitals. We need to have better infrastructures in our hospitals. We need to throw out outdated machines. So many outdated machines in the hospital. We need to throw them out. We need to get in good machines. We need to bring in new infrastructure. We need to pay our doctors, our nurses, our healthcare workers better. Despite the fact that it's a service to humanity, it is not bondage. It is not suffering. These doctors, these people are still humans. They can still be patient. They have families. They have friends. They have loved ones. We need to treat them as such. We need to treat them as humans, not animals, and pay them well. Pay them the right amount that's supposed to be paid. Get good infrastructures into our hospitals. Make it easy and accessible for every Nigerian. Like I said before, healthcare in Nigeria, it is not supposed to be a luxury. It is not a luxury. It's our fundamental right as Nigerians. It's our basic right as Nigerians. And I'm sure that this episode is going to really create more awareness, show more light, and get more people to really open up, speak up, and do the right thing. Thank you so much for watching today's episode. See you next time.